We're continuing to do very well on the vaccination front. As people probably saw in the news, the FDA has authorized the use of COVID-19 vaccine developed by the company Moderna. This was after doing the same extensive weeks-long review of all the safety and efficacy data on the Moderna vaccine that was done on the Pfizer vaccine. What was involved includes reviewing thousands and thousands of pages of technical data on the vaccine's clinical trials and on the manufacturing process for the vaccine. There were no safety concerns identified, and the data are indicating that the Moderna vaccine, like the Pfizer vaccine, is remarkably effective. It has a 95% effectiveness rate, which is incredible for a vaccine. Thankfully, also, we have an expert panel in our Rhode Island COVID-19 vaccine subcommittee. I want to say thank you to all of them for their commitment, emergency meetings, reviewing the data, asking good questions, really making sure that we're doing what's right for Rhode Islanders. That subcommittee has determined that the safety review at the federal level was sound and recommended that we use this vaccine, the Moderna one, in addition to the Pfizer vaccine. We expect 19,000 doses of Moderna vaccine to come into Rhode Island this week. 11,700 doses are coming into Rhode Island just today alone, which is very exciting. And by the end of the week, 35,000 doses should have come into Rhode Island from both Pfizer and Moderna. That includes roughly 5,000 doses set aside for vaccinating in our nursing homes, which is scheduled to begin just after Christmas. All through next week, when we're doing a lot of vaccinating in nursing homes, we expect our doses administered numbers to rise quickly. As of 9 a.m. this morning, as the governor shared, 6,400 first doses of COVID-19 vaccine have been administered in Rhode Island. We're in the last stages of finalizing our COVID-19 vaccination scheme. We shared the early form of it a couple of weeks ago. It's not going to change from that high-level view, but we're getting to the level of detail that we have in Rhode Island in terms of how we're going to distribute it so we can continue to be as effective as possible. And we'll lay out the order in which vaccine will be available to different groups in Rhode Island in the coming days. While we're making some final determinations about some very specific groups, as I mentioned, generally people won't be surprised by the final plan. We've described our approach in broad strokes, explaining that Rhode Island will be vaccinating people based on their risk level, and we will continue to maintain a focus on equity. That's why, as Dr. Chan said last week, we are finalizing plans to vaccinate in Central Falls early on in the vaccination campaign, and we'll move on to the other zip codes and communities that are hardest hit as well. Even within our hospitals where vaccinating is happening now, our expectation is that equity will be the guiding principle. One last note to say about vaccinations is we have not seen anything of concern locally, but there have been warnings about scams issued in other parts of the country. So we want to make sure that you're aware of that. No one will have to pay for vaccine out of pocket, and there is no list to get on to get vaccinated. If someone contacts you asking for financial information related to COVID vaccine, do not provide it.